Hey everybody, this is Dr. John Meese, and I'm here to do a little video for you about the #1 dental practice challenge that we see. Now, our office gets calls from dentists all over North America, and there is one problem that seems to occur more often than all the rest, probably more often than all the rest combined. This one thing increases costs in dental practices more than any other thing. This one thing causes the greatest loss of efficiency. This one thing causes more heartaches and more sleepless nights than anything else. And it's the one thing that sucks the most value out of a practice. What's that one thing? Well, before I tell you, I'm going to tell you a little story. I'm going to tell you a story about two different practices. The first practice, well, let's call it the average dental practice. It's a little bit short-handed to start with because dentists all want to have a low overhead, so they watch their staff costs very carefully, and so they're running just on the edge or just below being fully staffed. So they're already short-handed to begin with. Then, doctor, you hear this, and most of you have heard it before. It comes at the end of the day, usually at the end of a Friday. Team member comes to your office door while you're sitting at your desks and says, "Doctor, can I speak with you?" They step in and they close the door behind them. You know what's coming, don't you? They're going to quit. So team member quits right then and there. Then what happens? Well, now you've got 2-week notice, so now they're around for 2 weeks telling everybody how great their next job's going to be. Well, that's real good for morale. And you follow that with a month of advertising, collecting resumes, interviewing candidates. After that, once you finally pick somebody, of course you're going to pick somebody who has a job because you want someone who wants to work. So you have to follow that with the 2-week notice that they're going to give their employer. You follow that with weeks of training before they're good at anything. So all told, you've lost months, really, of productivity. Can you wonder why we get so many calls about this? It's just so common. And because this is such a hassle, doctors are fearful and they ignore team issues and team problems, which only makes them get worse and only makes them get more complicated to fix. And it's a vicious cycle. Meanwhile, while all this is going on, the productivity is going down, teamwork is strained, everybody's doing too much because you were a little short-handed to begin with, tensions rise, staff and patient complaints rise, and you'll probably get a buzzard circling. If you've been in practice long enough, you know what the buzzard is. The buzzard is that employee who senses that you might be a little shaken by the person that quit, that your confidence might be a little down. You may be wondering if the ship is going to sink. And so that buzzard comes in, they land on their shoulder and say, "I want a raise, I want a raise. And if I don't get a raise, I'm going to quit." You know, they pluck your eye out when you're down. If you're lucky, you have a buzzard. If you're not lucky, you have a pack of wolves who come to you en masse. They know you're down. They come to you en masse for a raise. It's kind of a shakedown. All the while, all this is going on, or the fear of all that going on, is costing you heart muscle and stomach lining, as my dental professors used to say. So that's the first practice. Let me tell you about another one. This one is fully staffed to begin with, and it's fully staffed because they found an easy way to keep it fully staffed. They have the same thing. Someone quits. But in the second practice, there is a pool of people already in line to become employees. With one email, they have a room full of people filling out applications. Their team, and this is important, their team is doing the entire process. While doing the process, of course, they're seeing how easily replaceable any of us are. The team has a process that they're fully trained on that takes the very best candidate from this pool of applicants. It actually causes that applicant to stand up, to pop out. They become so obvious to the team who would be the best fit. And within 2 weeks, you not only have them hired, but you have a system of training them in place, and they get better and better and better at doing their job. And guess what if they don't? You have a system to get them out and a system to get more people in. You can turn them loose if they just don't get it, if they just don't really want it, or if they just can't do it. And all of this is done entirely by your well-trained team. What's the difference between these two practices? Well, the second one, of course, has happier patients, has a happier team, and has a much more profitable practice standpoint. And the reason why that's so different is because they have developed a system to recruit, to hire, to develop a team of superstar employees. There is no more valuable system than this one, and it's an absolute must-have. Without a great system of building an extremely fantastic team, you have no chance of reaching your own potential. Well, I hope you've enjoyed this video, and I hope it helps you to develop the team of your dreams. I'm John Meese signing off. I hope to see you all soon.